I would like us to go over these general systemic signs of this Cushing's syndrome, because it's so very important that we recognize this Cushing's syndrome, the signs and symptoms, and know them very, very well, and be able to identify them very accurately. And one of the signs is gradual weight gain. I already explained how this occurs, but I'm going to keep on saying it, how there's going to be weight gain. Reason is because there's going to be excessive blood sugar, and when there's excessive blood sugar, we all know that the end game is weight gain. So that is set aside, and then there's going to be fatigue and weakness due to there's going to be excessive muscle weakness and all that. So there's going to be fatigue and weakness, and there's going to be slow wound healing. And reason is because protein is also converted into glucose, and we all know that protein is the body building. I mentioned protein is the body building, and when someone has an injury, the food source to give this person is protein. A person that is a post-operative patient, you are to put this patient on a diet, and which is the protein diet. And that is why there's slow wound healing, because there's not enough protein in the body. The protein is already converted to glucose. And then there's going to be increased susceptibility to infection. And then, let me recap again. For knowledge sake, before you put a patient on corticosteroid drugs, you're going to first monitor, observe if this patient is a diabetic patient. Is the patient already suffering from diabetes? Because this cortisol is going to also increase blood sugar, the sugar rates in the blood. So, and it is not good for a already diabetic patient. So you're going to know if your patient has diabetes. And then there's going to be increased susceptibility to infection, suppression. You all know that this cortisol is going to suppress the immune system, to reduce the inflammation and the immune system overreacting. And this patient is going to be prone to contacting infection. And that is why when a patient is placed on this corticosteroid, they are going to educate the patient. You're going to be educating of patient to avoid an area or a person that has certain infection, because this person, their immune is already suppressed, so they are prone to contacting infection. You see, as I mentioned, the general and systemic sign, there's going to be gradual weight gain. There's going to be fatigue and weakness due to muscle weakness, and there's going to be slow wound healing because of protein is being converted to glucose, and there's going to be increased susceptibility to infection due to their immune suppression. So I recap. There's going to be weight gain, gradual weight gain. There's going to be slow wound healing. There's going to be weakness and fatigue. There's also going to be prone. This patient is going to be prone to infection. And then the physical features. How can you identify a patient with Cushing's syndrome with their physical appearance? Is they're going to have moon face. Their face is going to be rounded and puffy. And then they're going to be buffalo hump due to fat deposition at the back and the neck. And then there's going to be central obesity with thin limb. There's going to be muscle wasting. The muscle there's going to be breakdown of glucose in those muscles, and so there's going to be thin limb and central obesity. There's going to be fat deposition in the belly. So note, there's going to be fat deposition in the face, causing moon face, in the back, causing buffalo hump, and also in the central part, which is the belly. And there's going to be thin limbs, which is arms and leg. And there's going to be purple or reddish striae. There's going to be a stretch mark on this patient's abdomen on their arms and on their thighs. And then there's going to be thin, fragile skin that bruises easily. This patient is going to sustain injury. And the main point, the worst part is when this patient sustain an injury, there's going to be poor wound healing. There's a hard time for wound to heal when this patient sustain injury. There's going to be acne, and it's going to be facial hairs. There's going to be hair, especially in women. There's going to be excessive hair growth in their face. And there's going to be muscle weakness, especially in the proximal muscles like the thigh and the shoulder. And there's going to be osteoporosis, there's going to be brittle bone, back pain, and possible fractures. And then the cardiovascular is going to be hypertension because there's going to be increased blood pressure. Cortisol causes increased high blood pressure. And it's going to also affect sodium and water retention, which is going to lead to edema. And then there's going to be hyperglycemia or steroid-induced diabetic mellitus. We all know the reason why this is going to happen, because glucose is being pushed in the blood. So what do you expect? It's going to be diabetes. So it's going to be steroid-induced diabetes mellitus. And then increased appetite. The patient is going to try to replace the used glucose in the body. It's going to be increased appetite. It's going to keep on pumping that energy. And then the reproductive / hormonal changes. In women, it's going to be absence or irregular menstruation, which is amenorrhea, infertility. So, and then in men, it's going to be decreased libido or impotence. Okay? And the neuropsychiatric manifestation, there's going to be depression, because when there's because this cause is going to cause the brain to stay alert, make purpose to stay focused and motivated. And there's going to be a backfall, causing depression, mood swing, or irritability. This patient is going to have issue concentrating. There's going to be cognitive difficulty. There's going to be anxiety, because when someone is overly motivated, this person is going to have anxiety. He's going to have anxiety, and you can't sleep. You're going to have insomnia. So for recap, for systemic or general signs, there's going to be poor wound healing. There's going to be fatigue and weakness. There's going to be infection. This patient is going to be prone to infection, and there's going to be gradual weight gain. And then how to physically identify a patient with this Cushing'S syndrome is that there is going to be moon face. You're going to see the patients with moon face, rounded and puffy face. There's due to fat deposition, and there's going to be fat deposition at the back causing buffalo hump, and then central obesity. There's going to be fat deposition on the stomach, and there's going to be central obesity, which is deposition on the stomach, and then there's going to be thin limbs, which is there's going to be thin arms and leg, and then fat deposition in the. And there's going to also be a purple or reddish striae. This patient is going to have stretch mark in the abdomen, in the thigh. There is going to be those signs. That is what you're going to see, those signs. And then there's going to be, in women, there's going to be facial hair, especially in women. There's going to be facial hair. There's going to be acne. And then reproductive or hormonal changes. There's going to be absent menstruation or irregular, which is amenorrhea or infertility. And then in men, there is going to be poor low libido and impotency. And then neuropsychiatry is going to be depression, irritability. There's going to be poor concentration, insomnia, and then anxiety. Hope you understand.